Good morning. My name is Stephanie Chayesky. I'm the Executive Director of the Academy of Doctors of Audiology, and it's my mission to help the Academy achieve its mission.
I'm Dr. Victor Bray. I have been in this space for a long time. I've been working with hearing impaired patients in one way or another, and I'm now on faculty at the Salus University Osborne College of Audiology. So part of my career early as clinician, part of my career in the industry, and now in academia. I am very excited about this phase of my life because I've been able to work hard with the Academy of Doctors of Audiology. I'm a past president, and I'm now on the board of directors for the Audiology Awareness Campaign.
My name's Alicia Spohr. I'm a practicing clinician, doctor of audiology in the Baltimore, D.C. area. I am a past president from the Academy of Doctors of Audiology, so I've gone through my tenure on the board holding various positions, with my presidency year occurring in 2018. And I am the current advocacy chair for the Academy of Doctors of Audiology.
One of the big barriers that we're working on is actually around the coverage of hearing healthcare services and hearing aids around Medicare. And I think there's a lot of confusion in both the Medicare Part B space, but also in the Medicare Part C or Medicare Advantage space. So there are a lot of Medicare Advantage plans that purport to offer a hearing benefit. And in fact, what they're really offering a lot of times is a discount plan, a discount option for members of that Medicare Advantage plan. And they use terms like copay when in fact there is no insurance half of that copayment. What it really is a discount plan that allows an out-of-pocket cost to the consumer, but yet they're using the term copay or they're using the term benefit. ADA would like to see more transparency in terms of how those third-party Medicare Advantage plans are executed, how they're constructed, and also to make sure that audiologists are being compensated fairly for all of the different services that they are providing that go along with that hearing aid, if the hearing aid is even necessary for each patient.
So what audiology is learning to focus on is stressing the auditory system in our testing to determine how well does your auditory system function when there's noise around you. And we're going to move from treating hearing loss alone, which is hearing loss in quiet, to focusing on helping auditory processing by helping people hear better in noise. And that's the path to the huge advance in healthcare.
Well, the one that's near and dear to my heart is the national legislation that we've been working on for almost a decade now, which is around allowing patient choice to see the audiologist without the barriers when it comes to Medicare Part B services, advancing the audiologist from the diagnostic supplier category into that practitioner category, and again, allowing coverage when it's covered under Medicare for those patients that need it when it's provided by the audiologist.
ADA's view on telehealth and teleaudiology is that it should be utilized at the audiologist's discretion where the care can be delivered in a consistent manner with an in-person visit. So as long as the standard of care can be achieved, it should be up to the audiologist to determine when, where, and how that care is delivered. So ADA is very pro telehealth, and what we found during the pandemic is that the states that had a more liberal stance on the delivery of telehealth services were the states where consumers and patients were more able and better able to get access to the audiology services that they need. And it was really important during that time because, as you may recall, everyone was wearing masks all the time, and it was very difficult for people who had a hearing loss to be able to understand their healthcare providers and just people generally as they had to be out in the world. There are still barriers, I think, when it comes to coverage of services when they're delivered by telehealth, and I think there are some more policy changes that need to be made in that regard, but I think we are seeing steps forward in that respect. So I think the payment policies need to start moving a little bit into a forward-thinking approach instead of always being 2 or 3 years behind the technology. I think there are ways to hold audiologists accountable for the care that they're delivering when it comes to patient outcomes without necessarily arbitrarily rejecting the idea or denying claims because the care is delivered via telehealth. There are so many different ways that care can be delivered effectively now